Now, Commissioner for Information and Communications for Kogi State, Kingsley Fanwo, joins us to speak more on this. Thank you so much, Kingsley, for joining us. Can you explain the specific criteria used to select the 80 primary healthcare centers that are revitalized under the first phase of the Impact project?
Thank you very much. I'm joining you live from Takitede in Mortality local government area of the state. I want to tell you that it's a major breakthrough in healthcare delivery in the state. 80 were commissioned yesterday. We have over 239 that are ongoing. We're having a partnership with the National Primary Healthcare Development Agency and the World Bank. And the state government is also pumping a lot of funds into it to ensure that we have functional primary healthcare centers in all of the wards in the state. And what we are working on right now is about 239. 80 have been commissioned yesterday. More will be commissioned in the coming months. And 249 others are coming, according to the Executive Director of the National Primary Healthcare Development Agency, Dr. Muyiwa Aida. And you will see that the commitment of the governor towards this is huge. He's committed to ensuring that we have functional primary healthcare development center. That's what can actually unlock the pathways to having good healthcare at the rural areas, the well-being of the people, and all of that.
So how is the state ensuring transparency and accountability? Because that's usually what people are big on in terms of disbursement and utilization of the funds.
Thank you very much. World Bank, assisted projects. When World Bank is doing anything anywhere, you have to follow the global best practices. As an administration, we have inbuilt mechanism for ensuring accountability and transparency. Remember, the governor is a forensic auditor, a chartered auditor. So we are ensuring transparency and accountability, and that's why we are having the kind of results we are having in that field. It is not all about the funds. It's also about having the best team. I want to say that the best health team in the history of the state is what we have right now, being led by the coordinating commissioner, Dr. Adeza Adams. And you can see that it's working very well in the state. I'm currently in Takite, the village. You have 2 primary healthcare centers that are ongoing simultaneously right now. And all of the villages around here, those projects are ongoing. So we have a platform. We have a very transparent and accountable platform for executing this project. So, the issue of transparency is not an issue at all.
So before we let you go, we also want to find out how will the government sustain these facilities financially, even after the World Bank support phase ends, because maintenance is another challenge that we have in this part of the world.
Yes, we have a structure for maintenance. It is not that we are building new ones. What we are doing right now is to strengthen the existing ones that we have across the state by ensuring that we do not only improve on the architectural development of those primary healthcare centers, but also to ensure that we provide solar power. We have to power the health sector in such a way that they have 24 hours electricity. And the best way to do that, judging by the situation of power in the country, is to go green. And that's why we are having solar power to be able to power those places. We also have water. So they have water, they have power. We are also building staff quarters so that it is not an issue of the person working at the healthcare center in the village has gone to his own or her own house. We have a quarter where they can live and then be able to work 24 hours every day. So maintenance is not an issue. Like I said, Governor Usman Ododo has become Mr. Primary Healthcare. He's such a person that has understood the need to strengthen primary healthcare so that people don't have to travel to their local government headquarters or the state capital to access the basic health care. And this is what he's investing a lot of resources to be able to, we are involving the community. We're involving the traditional rulers. And the executive director of the National Primary Healthcare Development Agency said it yesterday that Kogi has a robust structure. The traditional rulers are involved, the workers are involved, the local government councils are involved. So you have a very robust stakeholder structure to be able to manage these facilities. And the governor has already challenged communities to take ownership of these facilities and ensure that they protect those facilities from vandalism. What Kogi is building in the next 2 years, Kogi would be the best in terms of delivering primary health care to the rural poor.
All right, really, really good to know that, and hopefully these promises will be followed through. Thank you so much for joining us and shedding more light on this development. We appreciate your time.